Good morning. Today is Saturday, August 28, 2021. Today is our regular yoga therapy class via Facebook Live. Just 1 second. Okay. So today we have a very important topic, and let me discuss a little bit before I show you the practices. And as always tell you, yoga is a therapy. It is 99% practice, 1% theory. It is your philosophy. It is your 8-limb practice. This is your daily routine. This is your lifestyle. Yoga therapy is a lifestyle medicine. Today's topic, we're going to talk about yoga therapy, yoga into medicine, and medicine into yoga. And let me discuss a little bit first, because you as a yoga therapist or as a yoga therapy teacher, yoga therapy practitioner, you have to understand a little bit that what is the role of yoga therapist in our healthcare system today. I've been with this yoga therapy for a long time. I have a majority of my friends who are yoga therapists are non-medical personnel. Non-medical, I mean physicians or healthcare providers, and they have created a term which they don't like and they like to share with me. The term they use all the time called medicalization of the yoga, and they don't like it at all, and they talk to me, discuss with me all the time. My way of saying is, it is not medicalization of the yoga. What it is, trying to see the physiological effect of yoga practice and look at its outcome by your experience and by your research. It's a big word, isn't it? Obviously, the first and foremost thing, all of you have to understand that yoga therapy to sorry, something has happened here again, a technical stuff. Let me see. Okay, I'm back. I'm sorry, there was a interruption. I thought I stopped everything. Anyway, coming back, yoga into medicine and medicine into yoga. What does it mean? Let's first see our observation. People who are regularly practicing yoga and quote unquote yoga therapy. That means they're following the philosophy, following the 8-limb practice, following a daily routine, following a lifestyle. Undoubtedly what we have seen, number one, reduction of their pharmaceutical support. What does it mean? People who have a chronic diseases, who are on a multiple medication for say hypertension, diabetes, heart disease, we have seen their physicians were slowly removing the number of medication or dosage of the medication. So conclusion will be that if you practice yoga daily, you are going to generate a medication within your own body, which we call medication of our mind or medicine cabinet of our mind, and we are trying to find it out from our research. People who are regularly practicing yoga therapy, we have seen better control of the disease. People who have a hypertension, diabetes, lifestyle related disorder, even cancer, we have seen that the progression of the disease is a lot slower, or even there is a regression of the disease. People with a coronary artery disease, they have angioplasty, they have a bypass, and soon you will see they will have another angioplasty, they have a redo bypass. But people who are doing yoga, basically it's called a relaxation response, activation of the parasympathetic tone, do not progress the disease, even it regresses. And they have a quality life. People like us, I had open heart surgery 20 years back, I'm off medication, I'm enjoying a good quality life. Wake up in the morning, I do my routines, I do my yoga practice, I'm here to share my yoga practice with you, and I maintain a daily good life. And my friends comes and says, even my physician friends comes and says, oh, something will happen to me. I said, what will happen to me? I'm teaching yoga and drop dead? Yes, that's the way I like. I have to go someday, somehow, but my exit will be easier. And also we talk about medicine into yoga. Now look at what is our research shows. What is the connection between these two? When we start a practice of an 8-limb of yoga, you establish or develop a relaxation response. You establish a parasympathetic activation. It's like me. I'm talking to you, my mouth is wet. I'm having a lot of saliva in my mouth. Why? I'm in a relaxation response. Parasympathetic activation. Parasympathetic is called calm and digest. So, what is the physiological changes? Okay. Now look at all the chronic medicine we take. First of all, our modern medicine, we call it Western medicine, allopathic medicine, are primarily geared towards diagnostic abilities, primarily geared towards maintaining of the acute diseases. I have an acute coronary event, I have a trauma, I have an accident. What better it could be than a modern allopathic medicine? But the treatment of the medicine, like our pharmaceutical support, generally works through neurotransmitters, like it reduces or elevates neurotransmitters, like for people with depression, their serotonin level is down, the medication will raise the serotonin level up. And all of our research is showing a practice of yoga therapy increases your level of serotonin. So you don't need the medication for the depression, or you can slowly cut it down to a lot smaller dosage. You don't do it yourself. Your physicians will do it based on your improvement. People with Parkinson's disease, the dopamine level is low. Yoga known to have increased your dopamine level. There's a famous article say yoga increases GABA, called gamma aminobutyric acid, which is basically the ingredient of all our sleeping pills. So practice of yoga will correct your insomnia, sleep apnea. Correcting insomnia and sleep apnea, as I said all the time, will correct your metabolic syndrome, truncal obesity, diabetes, hypertension, heart disease, dyslipidemia, high cholesterol, high triglyceride, low HDL component. Medicine acts through blocking the receptors, enhancing the receptors, because people with a medication will have say, ARBs, angiotensin receptor blockers, and yoga acts exactly in the same place. Medication will act on blocking an enzyme, enhancing an enzyme, you've got the same thing. So how do you incorporate, say, connect? This very, very important concept. Let's look at the connect between the yoga therapy and the medications we take. It is not a statement that I am saying and you are going to accept it. Okay, now look at the concept. Person who has a coronary artery disease, what we call a regular heart disease, or a person has a metabolic syndrome with a truncal obesity, diabetes, hypertension, and the whole gamut I describe to you all the time. There are basically 4 fundamental medications: aspirin, statin, beta blocker, ACE inhibitor. In fact, these 4 medications became so popular, many of the drug companies putting all of them together in one pill, and they are marketing as called a poly pill. It's a wonderful way of marketing your product. So come back individually. I'm going to talk a little bit because this is a very important concept to understand. Person is taking aspirin. Aspirin primary effect is antithrombotic. Antithrombotic means it prevents the formation of the blood clot and it's anti-inflammatory. In a yogic lifestyle, you do what is called a water metabolism. Wake up in the morning, drink a glass of water, called it Ushapan. Then you drink a glass of water or a little water before your main meal, and 1 hour after main meal, drink a glass of water before going to bed. Drink a water when you are thirsty. Watch your urine, it has to be clear. Watch your mouth and tongue, which has to be wet. That means your hydration level is extremely normal not to have a thrombotic episode. There is no hyperosmolar state. Second, a relaxation response from the yoga therapy and activation of parasympathetic tone. What it does, it releases a nitric oxide. Nitric oxide, when you do nasal breathing, it comes from your sinus mucosa. Nitric oxide is a potent vasodilator. It opens up your blood vessel. And when every blood vessels are dilated, there is called endothelium, the inner lining of the blood vessel, called endothelial health. Inner lining of the blood vessel then start continuously producing nitric oxide and a lot of other hormone-like substances. So endothelium today is regarded as one of the almost like endocrine gland, and it is the health. Endothelial health is the overall general health. So practice of yoga therapy with the relaxation response and activation of parasympathetic tone improves your endothelial health, which helps in your antithrombotic function and anti-inflammatory function. All of our research studies show yoga therapy is a profound anti-inflammatory effect. So if you're talking about aspirin, we can say you can slowly and slowly you will be able to reduce the amount of aspirin you are taking with the consultation of a physician. Statin. Statin is used to reduce your cholesterol. And go back to the basic physiology. Body produces cholesterol for two things. Cholesterol is basically a backbone of your corticosteroid hormone, steroid hormone. And the cortisol, the steroid, is the hormone of your stress. So when the body is in a state of stress, it is producing more cortisol, and our liver is producing more cholesterol to supply the fuel to make the cortisol. So if your stress level is down, which is yoga therapy is called a stress buster, anti-stress practices, your body cortisol level is going to go down. When cortisol level is going to go down, body doesn't need that much of cholesterol, and your cholesterol level is going to go down. Cholesterol is used to make the bile salt, and the bile salt is used for the digestion of fat in our gastrointestinal system. With the proper parasympathetic activation, which is the nerve supply of all of your gastrointestinal tract, your food digestion is better, including your fat digestion. You don't need that much of bile salt, body is not going to produce that much of cholesterol. By activation of the parasympathetic tone, by able to reduce the level of cholesterol by anti-stress maneuver, your level of statin taking is going to go down. It's a wonderful explanation. If you have any question, if you have any comments, please post it to me on my site and I'll be glad to answer for you. Third is a beta blocker. What is a beta blocker? Beta blocker is given for the people with a cardiovascular disease or an underlying metabolic syndrome to protect you from a sudden rise in the blood pressure, sudden rise in heart rate. Remember, our coronary arteries, every blood vessel has a plaque. Plaque happens because your blood vessels are constricted of sympathetic tone. Your endothelium is not healthy. Endothelium has some cracks. Endothelium starts collecting the cholesterol and the calcium, it forms a plaque. Generally, plaque does not reduce your blood supply. Physics, a theory of flow through a pipe, you have to, the pipe diameter reduces of a whole surface area has to reduce to your 75% before the flow is reduced. But sudden rise in blood pressure, sudden rise in heart rate, what it causes a plaque rupture. So the plaque which was blocking 30-40% of blood vessel with a rupture, suddenly it causes complete blockage of the blood vessel with a total loss of blood supply to your heart muscles called myocardium or into the brain and causes a severe neurological or cardiac event. So beta blocker protects it. Now people who practices yoga as a therapy, they stay calm in the middle of crisis. So when you are having a crisis, when you have a problem in your car, a car broke down, you are in a 100-degree temperature, instead of jumping up and down, you just quietly call your service personnel, quietly call your AAA, they come, You'll fix your car. So you stay calm in the middle of crisis. So there is no sudden rise in the heart rate or no sudden rise in the blood pressure. Second, able to sit down is called a Sthiram Sukham Asana. Stillness, happiness, and in the pose, you will see that you have a better, we call it a baroreceptor sensitivity. Or think about, you are putting your head down. It's a practice we do in yoga therapy. Slowly put your head below your heart. When you put your head below your heart, what happens? Pressure inside your brain, called intracranial pressure. Pressure inside your eyes, called intraocular pressure. Pressure inside your carotid arteries goes high up. But if you keep your head down longer and longer and longer, initially you have a severe symptoms. Your head will get flushed, your eyes will start watering, you won't be able to talk. But slowly what happens? Body's neuroplasticity, that means habit forming, comes into play. There is called a phenomena called a baroreceptors. There are some baroreceptors in the blood vessel. Baroreceptor sensitivity goes up. So blood pressure doesn't go up suddenly, heart rate doesn't go up suddenly. In fact, practicing inversion poses, headstand, shoulders, and you see all inversion poses, slowly and essentially acts like a beta blocker. I put my feet on both sides. It's called Prasharita Uttanasana. I put my head down into the ground and I will do a Kapalbhati Pranayama. If you look at all the physical parameters which you do with this Apple Watch, you'll see exactly like call your beta blockers. Able to stay calm in the middle of crisis, able to practice inversion poses, creates a baroreceptor sensitivity. ACE inhibitor, called ARBs, angiotensin receptor blocker. It is primarily a vasodilator, primarily counteracts sympathetic overtone. And we have seen people with underlying coronary artery disease, when they are on this 4 medication, aspirin, statin, beta blocker, and ACE inhibitor, we find it out in our research is that people on ACE inhibitor, that is the medication which prevents progression of the disease and also reverses the disease. It's an amazing phenomena that you need to understand. So your activation of the parasympathetic tone acts like a ACE inhibitor. So I have physician friends who comes to my class, and guess what will they come from? They will come to the class because they're having some side effects, complications of your chronic medication intake. Remember, when you take a medication, it works great. Pharmaceutical supports are great for our body. You have a high temperature, take a Tylenol, temperature will come down, no question about it. You have a shortness of breath, you have a congestive heart failure. But when you keep on giving that medication for a long time, body finds a way to work around it. When they find a way to work around it, the body produces same thing, and body just saying to the medications, forget it, I'm doing my work through. a different route with the detour. We call it detour. So at the end, what happens, by the time you're taking a chronic medication for a long, long time, you end up with more side effects than the medication itself. So now you understand how the yoga into medicine and medicine into yoga works. And also remember that to establish yoga therapy as we call it a respected and a reliable and as a specialty, we have to integrate it with the Western medicine. This is called a part of your integrated medicine. So let's see what are the practices we need to create this relaxation response and our activation of parasympathetic tone. Now, I have seen the practices all the time. These are the practices you do for diabetes. These are for the hypertension. These are for coronary artery. Fine, nothing wrong with that. Keep doing it, definitely will have outcome. But sustainable long-term effect, you have to incorporate a daily practice in your lifestyle. It's a wonderful word to say, but we are all have a neuroplasticity, just got a habit forming, and we get used to it. And it happens to all of us. Here is the thing, I'm sure you've been noticing, I've been in stages I'm going. I'm talking to you, I'm in a relaxation state. I didn't go right away. First I did an easy pose called Sukhasana. Then I did a perfect pose called a Siddhasana. Now I'm in a half lotus called Ardha Padmasana. And then I'm going to a full lotus. It's called your Padmasana. How did I do it? I was talking to you. I was very calm, very relaxed. I could see I have saliva in my mouth. And my brain is neuroplastic for this lotus pose. I am not getting into lotus pose. My brain, my functional brain, which is called a motor and sensory cortex, is allowing me to sit down in this, and I have another brain beyond that, which is called an emotional brain, called limbic system, which is activated by the yoga practice, or yoga therapy practice, and that allowing me through called a limbic system, hypothalamus, pituitary, adrenal axis, or limbic system, hypothalamus, autonomic nervous system axis for me to be in this posture. A relaxation comes when your mind quiets down. When your mind starts to quiet down, what happens? In a sequential 8 limb practices, which is yam, the social restraint, niyam is the personal restraint, asana is external and internal alignment, pranayama is a voluntary regulated breathing, pratyahara, control of your 5 senses, dharan is the focus, 7th limb is dhyan, is the meditation. When you enter into the state of meditation, we call meditation is the medication. We go to our bathroom, we have a cabinet in the bathroom called a medicine cabinet. We get it out from medicine cabinet, but we have a medicine cabinet of our mind. This medicine cabinet of our mind secretes all the medication. So, able to sit down, this will create relaxation response. Able to shut down your 5 senses and create a vibration, with the same vibration as your brain, which will cancel, it's called harmonic resonance. It is called a bumblebee breathing, Brahma Pranayama. Able to sit down with your spine straight, able to stay all the time with your spine straight, able to walk with your spine straight, able to get up in the morning, put your body against a wall and keep your spine straight. Younger you are, you have a less disease. Your youth or young life is measured by only one parameter. If anyone can name that parameter, please write it to me, or I might forget later, or let me tell you. Your body's health and your youth in your whole body and mind based on one thing: flexibility of your spine. Rigidity of the spine is the pathway to your grave. Final rigidity, which we call a flat line in EKG, we call it a rigor mortis. So flexibility of the spine. It comes from keeping your spine straight. All the muscles in the back contracted to keep my skeleton up straight. So the moment I keep my spine straight, I give a relaxation to my muscles on the side of the spine called paraspinal muscles. I'm in a profound level of relaxation. Let's do a Brahma Pranayama. Let's do it a couple of times, which you have done with me. Index finger in the forehead, between your eyes, 3 fingers to close your eyes. You also can do Shanmukhi Mudra. Close your ear with your thumb and always do a breathing through your nose. Mouth is for eating and for talking. Always breathe out first, empty your lung. Take a deep breath through your nose and breathe out with the sound of a bumblebee. Next, we do pumping and cupping. Rub your hands, rub your hands. When you feel the warmth in your hand, take both the hands like a cup, put it over your eyes, let the eyes take all the heat from your hand, let the eyes get relaxed. Remember, eyes are the extension of your brain. Eye is the brain which is not covered by your skull. Relaxation of the eye relaxes your brain and your mind. Massage your forehead, massage your eyes, massage your face. All the muscles in the face are attached to the skin. Relaxation of the muscles removes all the lines, all the furrows. Your face starts to look glow. Massage behind your ear, front of your ear, in fact inside your external ear canal. There's a branch of the nerve called a vagus nerve, called auricular branch of vagus nerve. It stimulates vagus nerve, and vagus nerve is called the activation of parasympathetic tone. Bring your hand down, massage in front of the neck, side of the neck. This is called carotid sinus. You do a carotid sinus massage to activate your parasympathetic tone and it quiets down your cardiovascular and neurological disorders. Put your hand to the back, massage to your insertion of your sternomastoid muscle and a trapezius muscle, which are supplied by a cranial nerve, accessory nerve. See, you keep on doing this, these generates all the medications you are taking. Our body is capable of producing any medication you can name. Whole upper body relaxation comes from prayer pose to the back. Put your hand to the back. I have shown you many times, and then slowly turn your hand around and put it where you are comfortable. What you're looking for, two sides: no pain and effortless breathing. It's a yoga practice called foot shift to the breath shift. Annamaya kosha to pranamaya kosha. That means if you create any imbalance in your physical body to show up in your breath, as long as your breath is effortless, you won't be able to hurt your physical body. People always think about physical body as just a muscle, bones and joints. It is not. Pressure inside the eye, pressure inside the blood vessel, pressure inside your brain. These are all part of your physical normal physiology. When you get abnormal, it becomes a pathology. When pressure inside the eye goes high up, when you pay attention to your breath, you'll be sure your breath is interrupted. Your breath is not effortless. So I hear all the time, I have hypertension, I stopped doing it, there is a contraindication, my yoga therapist, my doctor asked me not to do this. Yes, but listen to your body's signal. What your body telling you? To diagnose with hypertension now, go back to where you started from. You don't have to do what you have been doing now or what you can do. Start it from, and then start slowly, effortlessly, and it's said in stages, impossible become possible. My hand is in the back, and I'm talking to relax, my hand is going high up slowly and slowly. I incorporate a relaxation of my neck, because that is another type part, which is called a Brahma Mudra. Then I incorporate my bumblebee breathing. So look at that. I'm in a lotus pose, and all of you have seen it before, but just show it to you again if you want to see that. I'm going to show you my prayer pose to the back. Here is my prayer pose to the back, and I'm putting my hands together to get good. If I keep it here, slowly it will go high up. Close my eyes, do my breathing out longer than breathing in, and slowly you will see the hands will keep going high up more and more. I stay here. Now I'll do my relaxation of my neck muscles, which is called a Brahma Mudra. I start with my breathing first, then I incorporate the bumblebee breathing. It doesn't take much time in the morning. Here I'm talking, I'm explaining to you, and also remember, effortless breathing means I'm able to talk, I'm able to sing, I have a saliva in my mouth. Please, my mouth is wet. I'm talking for some time now, 45 minutes, but I didn't take any water, my mouth is still very wet. So slowly drop your neck down, breathe out first, take a slowly deep breath in, put your neck to the back. And breathing out, slowly drop your neck in the front. There are 4 postures for the neck movement. What you're looking for here, no pain and effortless breathing. Next, we incorporate your bumblebee breathing, Brahma Pranayama. So breathe out first. With the breathing in, inhalation, you drop your neck to the back. Breathing out with a bumblebee, put your neck in the front. Next is side to side. Breathe out first. Take a deep breath in. Look all the way to the back without turning your shoulder. See my hand? Now going up more, higher up, because I'm more relaxed. Now turn your neck left to the back to the right, and right to the back to the left. Drop your head down. Breathe out first. Take a deep breath. Deep breath in. At this profound level of relaxation, my 5 senses are controlled. 5 senses basically means my mind. My mind is the content of your 5 senses. I'm slowly entering into the state of meditation. Meditation is a state when your thought process starts to reducing. What does it mean? My mind generates a thought process, thousands and thousands of thought process. Out of these thousands and thousands of thought process, 95-98% are repeat thought process. Same thought process keeps on coming to you, which is called we call it a monkey brain. In a state of meditation, you enter in between the thought process, which is called a gap. Gap slowly and slowly gets longer and longer. Essentially, you only have your regular thought process, but no repeat thought process. We're in a profound level of meditative state, and at this point, your body is generating every medication you need for your healing. I, as a physician, I can submit to you. Go ahead and draw my blood. Check myself. I can guarantee you, you will find whatever medications you are looking for in my blood. Physiologically, I can feel the effect of the relaxation. I can feel the effect of parasympathetic activation, and I'm also monitoring through my health tracker. If you look at all the papers, what the practice of yoga therapy does to your neurotransmitters, to your anti-inflammatory, your anti-thrombotic, your gene expression, in your apoptosis, in your telomere length, go to PubMed, P-U-B-M-E-D, PubMed.org. You will see everything there. I don't need any more practice to show it to you. Yoga into medicine and medicine into yoga. With this relaxation, you'll be able to do a whole set of pranayama. We did last Saturday. We did the whole daily practice of pranayama. You will be able to do it. Next, what is hurting us today most is your insomnia and sleep apnea. So, in next part of the practice, let me show it to you how you need to sleep. People ask me, how do you sleep? I said, two people who sleeps very well. One is your babies, one is your yogi. I said, sleep like a baby, sleep like a yogi. So sleep has a two component. As you know, it's called the REM, rapid eye movement, and non-REM, non-rapid eye movement sleep. In a rapid eye movement sleep, the mind is still active. That is the time you have all the dreams. And non-REM sleep has 4 stages. Stage 1, stage 2, stage 3, stage 4. Stage 1 and 2 is almost half of it, 50%. And also REM sleep is about 25%, non-REM sleep about 75%. It's a deep sleep, that means your non-REM stage 3, stage 4, when the sleep helps repairing all of your body's damage we have done. Sleep is like recharging your cell phone. So for the yogis, they're always in a stage 1 and 2 of the non-REM sleep throughout the whole day. They're in a meditative state. As I said, I'm showing it to you. My mouth is still wet after talking for so long. In fact, I get so much of saliva when I'm practicing, sometimes it's hard for me even to talk. My mouth is full of saliva. So this is amazing, amazing phenomenon. So you need a very, and let me show you to sleep. That will understand how it generates all the medication. When you first go to sleep, obviously we do at night, If you brush your teeth, do your flossing, everything, then you do the oleation of your nostril. That means you put a little oil inside your nose, or you take a little oil in your finger and put inside your nostril. What it does, it prevents the dryness of the nostril. With the dryness of the nostril, what happens? You don't have the dry mucus, which you call a snot, to block your nasal passage. So your nose stays open and you breathe through your nose. And you sleep through your nose, not through your mouth. When you breathe through your mouth when you're sleeping, that is a snoring, that is sleep apnea, and that is the beginning of your ill health. Therapy for insomnia is your bumblebee breathing or Brahma Pranayama, and therapy for your sleep apnea, Ujjayi Pranayama. So now you are laying down here. Hopefully you can see me. So when you sleep first, your nose is oleated. Hope you see me. Yes. Be sure your head is down. Don't keep your chin way high up. If your chin is way up, put something underneath. Put a small. I always prefer a folded pillow. Folded blanket. In a folded blanket, what happens? A folded blanket will you'll be able to remove the foldings when you feel a little bit more comfortable. Sleep in a very hard surface. If you're on a mattress, be sure mattress is so hard, it's almost like this. I'm in a concrete slab. I'm sleeping on a little very thin yoga mat, but I'm in a concrete slab. I put myself in relaxation. You will see a baby. I'm sleeping like a baby. Baby's hand closes, thumb inside and close. This is called a baby fist, Balu Mushti Mudra. I'm putting a baby fist, then I sleep like a baby, which is called Supta Baddha Konasana. Laying closed angle pose. Put your feet together and knee keeps on coming down. If you become too uncomfortable initially, you can put two pillows underneath your both the knees and you sleep like this at the beginning. Your hands are relaxed. Slowly and slowly body get relaxed. Next relaxation is called abdominal breathing. Put your hand in the abdomen, and when the baby is sleeping, you see baby always has abdominal breathing. During abdominal breathing, when you inhalation, your abdominal wall will go high up. Exhalation, abdominal wall will come down. So when you're sleeping, remember you have some lag period. You have a 10 minutes to 30 minutes to fall asleep. You sleep before 10 minutes, you are sleep deprived. People always ask me about the sleep apnea, all the sleep studies. These are all beautiful studies. But if you're not having enough sleep at night, you have a daytime sleepiness, and you don't feel good throughout the whole day. So I will sleep like this with a hand with a baby fist in the beginning, and I will do about a few counts of abdominal breathing, maybe 10 to 20. I incorporate this my pranayama practice for my sleep. After few abdominal breathing, then I practice breathing out longer than breathing in. I'm comfortable doing it for a long time. I can do count of 2 in, count of 4 out. I breathe out first, count of 4 in, count of 8 out, count of 5 in, count of 10 out. Let me show you count of 5 in and count of 10 out. I will do it about 5 to 10 times, but I'll show you a couple of times just to show you how to do it. Breathe out first. Breathe in with a count of 5 in. Breathe out with a count of 10 out. Very easy for me, very comfortable because I've been practicing. You practice at the level of your comfort. Don't push yourself. Don't compete with anybody. I will do it about at least 5 to 10 times. Very simply. Breathe out first. Breathe in with a count of 5 in. Breathe out with a count of 10 out. So I did the abdominal breathing, practice breathing out longer than breathing in. Now I'll do breath holding. Breathe out first. I'll breathe in with a count of 4 in. I will hold my breath for count of 16. I breathe out count of 8. 1 is to 4 is to 2. Then slowly I increase the ratio. Then I'll do count of 5 in, count of 20 hold, count of 10 out. I will do about again 5 to 10 times of this. Let me show you a couple of times just to show it to you. Breathe out first. Breathe in, count of 4 in. Hold your breath for count of 16. Breathe out with the count of 8 out. Increase one more count. Breathe out first. Breathe in with a count of 5 in. Hold your breath, count of 20. Breathe out with a count of 10 out. Remember, it doesn't take much time when you practice on your own because we have about 10 minutes of lag time before you go to sleep. So this is the way the baby sleeps. If you look at your kid, your grandkid, you will see all the time that's the way the baby is sleeping. Now you go back to the sleep like a yogi. A yogi will sleep first on your right side in a right lateral with your fetal position with the head under their hand. They don't have any pillow. They put the head on your hand. They bend the knees like a fetal position and they stay here initial period. Staying on the right side first, your left nostril opens up. Left nostril is cooling. Chandranai, parasympathetic. Sleep does two things primarily. It does a lot of things, but two things. It reduces your body core temperature and it causes profound muscle relaxation. Initially, your body core temperature is high. Breathing through your left nostril causes balance of your inner body core temperature. Then slowly turn around and sleep on your left side. If you cannot put your hand, initially if you put your hand, you will see maybe your hand will get numb and you'll feel a little discomfort in your hand. Then you can put a little small pillow and put your hands on the both sides. But again, slowly and slowly get used to it. You have a phenomenon called a thoracic outlet syndrome. We get a thoracic outlet syndrome, but prayer pose to the back, relaxation of the neck, by Brahma Mudra, it corrects. And my hand doesn't go numb anymore. This is the way I sleep throughout the rest of the night. And this is the way yogis sleep throughout the whole night. The reason is, two physiological reasons. Number one, anatomical reason is, my main venous return of my body, called inferior vena cava, which is bringing all the blood to my heart, is on the right side of my aorta. This is the way there is no pressure, because inferior vena cava is a low pressure system. So all the blood is coming back into your heart and having a profound, called a increase in my preload. More blood is returning in my heart. I'm relaxed. My heart is called a decrease in the afterload, which increases your ejection fraction, the function of the heart. Improving function of the heart, improve rest of your body. In yogic philosophy, left side opens your right nostril. Right nostril is heating. Right nostril is sympathetic. Right nostril is Suryanari, sun energy. Body core temperature is going down during sleep. And the right nostril breathing is keeping our balance. Always remember that when body core temperature is down, you have to do the opposite. People get so much of kick out of it when I tell them during summertime, outside temperature is high, body inner core temperature is low. Balance it. If you drink, you should drink a little hot water, warm drink instead of cold drink. But people will have a cold drink during summertime, think that it is the opposite they're doing. Opposite is outside, opposite is inside. And during winter time, when inner core temperature is up, you should drink a little colder fluid. Finish your sleep, you extend your foot on the top, the right, put your hand slowly and get up. Very nice and comfortable way. When you wake up, generally you wake up without an alarm. When you wake up without an alarm, that means your sleep is adequate. When the sleep is adequate, you have generated every medication in your body and mind. So these are simple practices which you incorporate throughout the whole day, which I do it all the time. Then when you get up, I wait a little bit on the side of my bed. Then I sit down. And sit down, this is always practice. This is a wonderful yogic sitting practice is your malasana, squatting pose. When you sit down, able to sit down in a squatting pose, slowness happen, relaxes your ankle, relaxes your knees, relaxes your hips, relaxes your back. Sitting down in the morning, I drink a glass of water, which is called the Ushapan. See, I do it all the time, massage your hand, massage your face. It's a wonderful practice. Separate your hand. When you're able to separate, the hand gets relaxed. Tight hands doesn't get separated like this. Separate your wrist. Put your one elbow inside, other elbow inside. Put your hand inside. Keep your spine straight. Look straight. Close your eyes. Breathing out longer than breathing in. When you do balancing poses, when you're able to stand on one foot with the eyes closed, which I've shown you for hundreds of times, body, mind generates all the medication. Here, the mind is generating all the medications. I don't have to go any farther. If you have any comments, please let me know. If you have any question, you let me know. Only thing I tell to my friends very simply, when you can't take the heat, get out of the kitchen. I understand the basic physiology, understand how the medication works for my body for chronic diseases. I can understand how the yoga therapy works in chronic diseases. I can tell you how your pharmaceutical support is going to go down slowly and slowly by the combined action of you and your integrative physician. Physicians who doesn't understand the relaxation response, parasympathetic activation, what happens to your body and mind, physician will examine you and tell you, you're looking good, everything looks fine. I don't understand what you're doing, but please keep on doing what you're doing. Because they're also very science oriented. They look at the numbers. We also don't. We're looking at the numbers here. And the new one, what do you call the Fitbit, Apple Watch, new ones does everything. Sleep tracker, deep sleep, your blood oxygen level, EKG, my one does the EKG, heart rate, blood pressure, you name it, it will do. So you have all the numbers in your hand, so you can see. Okay, just let me do one EKG, let me see. "30 seconds. Beautiful, wonderful EKG, and so I did a 30 seconds EKG to see the effect of this on my body and mind. Perfect EKG. It only picks up atrial fibrillation. If atrial fibrillation, it will pick up. Sometimes you can see ST segment, but that is not a very reliable finding. But at least you can see the rhythm, rate, all of them in EKG. Let's finish with a meditative yogic experience, which all of you have, which is a breath-centered meditation with a alternate nostril breathing without closing your nostril. Sit down in a comfortable yogic posture. For me, a simple yogic posture and relax is a lotus position. Why? The lotus position is give you a profound relaxation of your body and mind. In fact, we call it a meditative pose. If you stay here a little longer and longer, your body slowly and slowly enters into a sequence of yogic steps from asana to pranayama. The pranayama basically means effortless breathing, breathing out longer than breathing in. Exhalation is parasympathetic, inhalation is sympathetic. Enter into a pratyahara, control of your senses, dharan, the focus, then into your meditation. Use your hands called mudras, dhyana mudra, gana mudra, touch your index finger and thumb, put it over your knees. Keep your spine straight, keep your eyes closed and visualize your breath. Visualize your breath in front of your nostril. You will be doing all in this silence, but I'm talking because I'm guiding you. Visualize breath is coming through your nostril. Your nostril is your personal filter. Filters all the dirty air which is coming from outside to our nostril. Our nose is also a personal air conditioner. If outside air is warm, it will cool it down. If outside air is cold, it will warm it up. Puts the air on the side of the nostril, which are called turbinates. Turbinates are like furrows which creates a vortex. This vortex goes over the mucosa of the sinuses, and the mucosa of the sinuses releases a substance called a nitric oxide. Nitric oxide is a potent vasodilator. It dilates the blood vessel. It keeps our endothelial health. Endothelial health is a true sign of our health. Nitric oxide is also a mediator of a parasympathetic tone. Other two substances which mediates parasympathetic tone are acetylcholine and cyclic GMP. Visualize the air is coming behind your throat. Visualize is coming on the upper part of the lung, middle part of the lung, lower part of the lung, almost to the level of your belly button. Hold your breath for a short time at the level of your belly button. Sanskrit is called a Kebal Kumbhak. Then visualize the air coming in the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming out through your nostril. Outside the nose, the breath picks up a subtle energy called prana. Prana is a subtle energy which keeps us awake, alert and alive. Breath is not the prana, breath is the carrier of the prana. Metaphorically, breath is like electricity and prana is breath is like electric cable and prana is electricity. So the electric cable like a breath carries your prana. In yogic tradition, our whole body does the breathing. Our skin does breathing, our liver is breathing, our kidneys are breathing, our whole body is breathing. Prana does a healing called pranic healing. Now visualize your breath taking the prana to the organ of healing. I have a heart problem, I'm visualizing prana is coming to my heart. It's causing a healing of my heart. If you have a back problem, you visualize prana is coming to your back. causing the healing of your back. If you have diabetes, you visualize prana is coming through your pancreas, causing the healing of your pancreas, having more insulin output. All my sensations are going down. I'm touching the tip of my index finger with the thumb, and I can feel my sensation is going down, and my awareness becomes so complete. I can even feel the capillary pulsation on the tip of my fingers. I can feel clearly the pulsation tip of my index finger and thumb. As you say, I'm talking to you so long, my mouth is still extremely wet. That means a parasympathetic activation. I did not drink any water at all. Bring your awareness to your nostril again. Visualize your breath and breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Initially, it feels like almost impossible, but I can clearly see in this state, I'm breathing in through my right nostril. I'm breathing out through my left nostril. In a normal practice, I'm in silence. In silence, I brought my mind to my breath, and I'm doing the alternate nostril breathing in silence. Once you continue for a while, then bring your hands in front of you, touch your little finger and thumb, separate your ring finger, middle finger and index finger, called a lotus mudra, Padma Mudra, connects your body, mind and spirit, which is yoga. Bring it slowly towards your heart. The heart is the site of your soul. Mind and soul is connected. All the healing happens from your soul. Atma Darshan. Bring your hand closely in front of your heart chakra. Hands in the front. I honor the divinity within you. And people always ask me, is it a yoga? It is a yog. It is a jog. I said the original Sanskrit word is a yoga. Different areas in India, they have a local dialect. For the Westerners, it was very hard to pronounce yoga, so they put in an A, called it yoga. So when I'm in the West, I pronounce it as yoga. When I'm in India or I'm in a yogic environment or in a Sanskrit environment, I call it a yoga. I also, from a Bengal, the Bengali area, Bengali speaking in Bengali, call it a jog. So when I do the program in Bengali, I call it a jog. So it's entirely correct, whatever word you use, but as long as you understand, it's a union of your body, mind and spirit. It's a wellness. Physical wellness gives us strength and stamina. Mental and spiritual wellness gives us healing. Gives us all the medication we need from the medicine cabinet of our mind. Finish again with the pumping and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, take the hands like a cup, put it over your eyes. Let the eyes take all the heat from your hand. Then massage your forehead, massage your eyes, massage your face. Massage your ear, behind the ear, in front of the ear, inside your external ear canal, which is a auricular branch of vagus nerve. Activate vagus nerve. Massage your carotid sinuses, which is a calming, cooling effect on your cardiovascular system and nervous system. Massage the back of your neck, insertion of your trapezius and sternocleidomastoid muscle. Wonderful practice. You have all the documentation, yoga into medicine and medicine into yoga. And with your chronic diseases, with taking multiple medication. I have seen my friends taking 10 medication, 15 medication daily. They're on the hour, off the hour. They put them on called the medicine boxes. Plus, the drug companies are captured you. They call it pharmacomafias. I have friends, they have to take medication at 9:30. And if at 9:31 they have not taken, literally they're dead. Keep on doing a practice of yoga therapy. The pharmacomafias are not will be able to control you anymore. All my physician friends who comes to my class, who wants to learn yoga therapy, comes from one basic fundamental reason. They're on multiple medication, having side effects, and they want to get rid of the medication. What I tell them, adopt a daily practice, and in stages, impossible become possible. Karo Yog, Raho Nirog. Keep doing a daily practice of yoga, and you will stay disease-free, healthy. You will have a wonderful, disease-free, medication-free, and a wonderful lifestyle. You enjoy your life. Thank you. We'll be continuing again on this Saturday morning classes. Next Saturday, I probably may be out of town, but I will let you know beforehand. If I'm out of town, I may do a program from out of town. If not, we'll skip and come back again next Saturday. Thanks for the joining.